Doctors, nurses, and other medical professionals are turning to technology to help them learn new skills and brush up on old ones. In our cover story, Rod Starnes shows how Baptist Memorial Hospital Memphis is expanding its efforts to improve patient care while protecting patient safety.
At first glance, it looks like a critical care case. A patient in pain, caregivers moving in to assess the patient's condition and then provide the proper treatment. But there's obviously something out of the ordinary about this situation. The patient isn't flesh and blood. It's a computer-controlled simulator, one of several in a new 5-room simulation center housed in Baptist Hospital, Memphis.
And in these rooms, we can simulate anything from a pediatric patient in the hospital to a pediatric emergency, a critical care unit, which is what we're in now, an emergency room unit, a med-surg unit, post-operative, multiple different situations that a patient would be in a medical surgical unit. Then we also have a birthing room where we can do labor and delivery.
The simulation center at Baptist Hospital Memphis has grown from a single room to 5. They mirror, down to the smallest details, just what you would find in most hospitals. The use of realistic simulators as training tools is growing in medical centers. Technology allows the devices to mimic human traits, all of which can be programmed into scenarios that are used for training. Simulators eliminate the need to try to find a hospital patient with a certain condition.
A lot of the situations that you see in the hospital in the emergency room, you don't see them every day. So having a center like this where you can simulate a flailed chest or a neck injury where you have to intubate a patient without hurting a patient, that's going to improve the quality of the therapists that work here at this hospital.
The Simulation Center programs display a wide range of complaints that can be presented to doctors, nurses, or other professionals. The simulators are controlled and monitored from another part of the center. TV cameras follow what the trainees are doing and allow the controllers to make unexpected changes or throw curveballs as a scenario unfolds to see how trainees handle things. But even in the most serious situation, no one will get hurt.
We're able to simulate critical situations here in the sim lab without harming the patient.
The technology allows the Simulation Center staff to change the patient's conditions in real time. But things can be sped up so that administering a treatment may lead to a simulated patient getting better immediately, so a trainee doesn't have to wait days or hours to see what the correct response is. But they can also see no change, or the simulated patient can get worse. All things that could happen in real life.
One of the best things is it's a safe environment. We can replicate situations that these clinicians may not come in contact with in 6 months, in a year. So very, very what we call low volume. And you want to make sure that you're prepared and that you're safe to respond to this.
So using simulators has a dual advantage over using real patients in certain teaching situations. Healthcare providers can repeat this process as many times as they need to master it. And they don't have to worry that a mistake will cause any problems for the patient. It's also possible for others to follow the action.
This particular lab is set up to where we can actually run a scenario and have 20 people in another room looking at it and critiquing it.
Here in the Simulation Center's conference room, entire exercises can be recorded for later review. Those reviews can include the trainees, making it easier for them to see how well they handled an exercise and to see how to use those new skills in a real-world situation.
We can simulate seizures, so we can teach nurses how to respond to those seizures, what medications to give.
The training isn't just for the medical professionals in the Baptist Hospital system. Now that the expanded center is up and running, there are plans to bring patients and their families to the center. It's hoped that will serve the purpose of reducing a lot of the anxiety that can be tied to the hospital experience by giving people a nearly real look at what can happen inside a working medical facility. For Smart Medicine, I'm Rod Starnes.